Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel today. Reminding you as usual that if medication fixes your problem, that's a medical problem, not a mental problem. Today I'm going to be talking about what I call pathological hair pulling, which in the psychiatric literature is called Trichotillomania. But basically, this is viewed as an anxiety disorder that a lot of times people don't say that they're anxious. They basically say they're pulling their hair out. And that's what pathologic hair pulling means, that it's pathologic, that you're yanking your hair out and you can't stop. And it's a problem for you, which makes it a disorder. So trichotillomania being the official medical diagnosis, that sounds like a big word. It's basically can't stop pulling my hair out. It takes various forms. Sometimes people sit with their hair just like twist and twist and twist and pull, and they get a little bit of a bald spot, and then it gets a little bit more, and then it gets a little bit more. And sometimes people with longer hair, typically, people that, have to brush their hair, well, they end up just twisting it in knots, and eventually it starts to pull out. Other people don't pull their scalp hair. Sometimes people pull their eyebrows, so plucking these. And sometimes people come in and they will have no eyebrows, compared to somebody who's got a big bald spot like the size of a softball or a baseball back here from just pulling and pulling, pulling. Sometimes they'll have literally no eyebrows, just boom, boom, boom. And people actually describe not even really being aware of doing it. Is that they'll just realize, look in the mirror one day and go, I can't believe this. Well, I've got no eyebrows, because they're a lot of times just thoughtlessly pulling. Sometimes it's eyelashes. They pull our eyelashes out and pluck and pluck and pluck and pluck and pluck. And those are the big pulling areas. Now, sometimes people pull arm hairs and pubic hairs, but more often than not, people stay with their face. And you don't see people with the bald spots on an arm. For some reason, people don't pick hair off their arms to their legs so much. When it comes to underarms and pubic hairs, a lot of times it's people shaving too short and feeling almost obsessively like if they haven't shaved in the last 12 hours, they have to continue to shave. So they'll be very, very bald from shaving, and a lot of times that the skin gets red and inflamed, and it's a problem. Sometimes it's using scissors to cut arm hairs or pubic hairs too short. Now, I don't know why people use scissors sometimes, but there are some people that just feel more comfortable using scissors. It would scare me, actually, but that's what people say that they do sometimes. All of these behaviors fall into a category that, again, is officially classified as an anxiety disorder, but it's really a chemical disorder, because many times in my office it does respond to medication. So what medications do we use? Typically, it's either the serotonin boosters. So if your serotonin is low, we give medicines to boost it, or dopamine suppressors. So if your dopamine is high, then we push down your dopamine with medicines. So typically, serotonin is thought of as a feeling chemical. So if you feel anxious, feel depressed, then raising your serotonin is a good thing. But that also applies to people that have pathologic hair pulling. A lot of times, people that pull their hair and shouldn't be, they feel better with serotonin boosters. Now, the ones that I use typically are what you consider to be the stronger of the serotonin boosters, the less gentle ones. And the first one is Prozac, fluoxetine, and the second one is Luvox, fluvoxamine. Prozac being officially approved for depression, Luvox being officially approved for obsessive compulsive disorder. Both of these medicines, both these serotonin boosters, oftentimes help people with pathologic hair pulling. Why do we not, the word obsessive, people sometimes say, well, if they're obsessed with hair pulling, why don't they call it an obsessional disorder? Well, you could say from a layperson standpoint that they are obsessed with pulling their hair, but it's typically not associated with the thought. People that have obsessive compulsive disorder, they have unwanted intrusive thoughts. So the people that have pathologic hair pulling, they don't describe having a thought of, I must pull my hair out or something bad's going to happen. They simply mindlessly sit there and twist and twist and pull, or pluck and pluck and pluck and pluck, or shave and shave and shave and shave. So those are the reasons that I don't typically call this part of the obsessive compulsive spectrum, although those are all part of the anxiety disorders. Now, the other treatment besides serotonin boosting would be dopamine suppression. So dopamine is typically thought of in my office as the thinking chemical. So if you're making too much of the thinking chemical, you'll think too much. So it doesn't really fit that people would thoughtlessly pull their hair or pluck their eyebrows or their eyelashes it's not really intuitive to me that they would do better with a medicine like Zyprexa or Geodon or Latuda or Perfenazine, the Vraylar, Abilify, the medicines that we use to push dopamine levels down. But in fact, they do. So that sort of highlights the fact that if you cannot use the serotonin boosters, or the serotonin boosters, 2 or 3 of those fail, then as an attempt, you would just try a dopamine suppressor and see what that happens. And if it helps the problem, then there you go. That's really what you want. You don't, the reasoning behind it doesn't matter as much as the result. So I certainly have patients who have not been able to either take or benefited from Prozac, Luvox, Zoloft, and with a trial of a medicine like Zyprexa or Abilify or Vraylar or Latuda or Geodon, did better with the dopamine suppression. So again, doesn't really matter if it's supposed to work. If a patient's asking for help and the serotonin boosters don't work, certainly I would try a dopamine suppressor without hesitation, knowing all the while that it's off-label. But if it helps them, they're going to want that. So if you are struggling with pathologic hair pulling and you don't know why, and you've thought that this is something that's just like hard to overcome and I don't know why I do it, but I've got a bald spot on my scalp, or I have no eyebrows, or I'm pulling all my eyelashes out and I just can't stop pulling my hair, well, talk to whoever's taking care of you and ask to see if, first of all, a trial of serotonin boosters might be helpful to you. And again, that would be a month at a dosage of Prozac. So 20 milligrams, not saying to do this, but this would be an example of somebody who had never had treatment before. I might try 20 milligrams once a day of Prozac for a month, and then 40 for a month, and then 60 for a month. And that's actually parenthetically something important to say, that typically patients with pathologic hair pulling, they typically don't get better with low to medium dose serotonin boosting. Most times when we're doing serotonin boosting, we have to use high dose serotonin boosting. So at the maximum dose of Prozac, for me, that's 80 milligrams per day. Luvox, 200 milligrams per day. Zoloft, 200 milligrams per day, the maximum dose that we use for that. So if you have that problem, talk to your provider about that, and hopefully if they give you a trial and helps you, then this video would have helped you. If you know somebody that's struggling with this, please refer them to this video. Thank you for coming to the channel today. I appreciate how many people are watching these videos. I feel like we're really helping a lot of people that maybe didn't have as much idea about the medical aspect of what they call psychiatry, and I'm certainly committed to staying with it. And after we got our new studio, recovering from the fire, everything's great in the new studio. I'm very comfortable here, and I'm happy to continue doing this with you. So I'm Dr. Dave Psychiatry. Thanks for coming to see me today.